man, you're getting called a physician for the very first time. You have those two
Yeah.
letters after your name. And with that comes a ton of responsibility, this pressure, really intimidating those first few weeks. You're really worried you're going to mess up. You just really feel hesitant to be a physician, even though these patients are calling you doctor.
Well, it's become real now. It's not just the textbook, right?
It's horrible. But it's like self-inflicted. All right, well, welcome back to the Heflinger podcast. We've got a special guest tonight, Cam Tate. He's actually a second-year resident in internal medicine, and it's going to be a great conversation to hear how he is doing in residency.
Thank you so much for having me. I appreciate it.
Yeah, great to have you here, and we're excited to dive in. I think there's a lot of medical students and people who might be in residency or thinking about medical school, so it'd be great to hear your perspective.
Cam, are you on call right now?
Luckily, I'm not.
Okay,
No.
good.
To start off, you want to tell us a little bit about yourself and maybe why you got into medicine and why you chose internal medicine as your residency?
Yeah, sure. So I'm born and raised in Nashville, Tennessee. None of my family are physicians, so I don't really know the origin story exactly why I wanted to do medicine. I ended up telling my dad in 7th grade that I wanted to be a doctor, and I just stuck with it ever since then. And I was excelling in science courses through middle school, high school, and I had a mentor, Dr. Tanksley. Shout out Dr. Tanksley. He pulled me aside one day and was like, hey, if you want to, you could really try for medical school and be a physician. Has anyone ever talked to you about that? I was like, well, funny enough, that's kind of my plan, but I had no direction whatsoever. So he kind of was that first catalyst that kind of pushed me in that direction and was like, hey, you could do this if you want. And then I ended up volunteering at our local children's hospital and got to have that firsthand experience, seeing the impact that physicians can have in patients' lives. Not only, these sick kids that just, everyone feels for them, but their families and their siblings, and they're from out of state and they're staying there for months on end. It's just, the honor and kind of power that comes with being a physician to really help people struck me, and just end up continuing to go through pre-med and medical school. I was torn between internal medicine and surgery. I love the grind of surgery, working with your hands, kind of, the tactile aspect of surgery. And then I love the cerebral aspect of internal medicine, thinking through big problems and honing in on the nitty gritty and kind of managing the entire patient really stuck out to me. And then I did a rotation in GI, and it was the perfect mix of the two, the interventions, scopes, and then long-term patient management just kind of ended up standing out to him.
It's funny, when I was in medical school, I did my internal medicine rotation early, and I fell in love with it because it's like being an investigator, right? You have to figure out what's wrong with the patient and, really dive into their history and all the labs and stuff. And it's really a cool field. I really consider going into it. Yeah. So your pre-med track, did you go from pre-med to medical school, and aren't there some programs that have like combined, where you can do combined medical school and your residency?
Mm-hmm. Yeah, there are combined programs. I ended up doing so straight through college 4 years, and I took a gap year.
Uh-huh.
I think one of your previous episodes mentioned this. It's almost the norm now to take a year or two before medical school to kind of, study for the MCAT and do all the extracurriculars, and then taking those gap years after medical school for the research and anything before residency. It's just gotten so competitive. So I ended up doing that, working in a hospital. I was basically the janitor in the ORs, just sweeping up bones from ortho cases, wiping up the blood off the table, transporting patients. I started from the bottom.
What do you think was the hardest part about medical school?
I think for me, it was difficult transition from undergraduate to medical school. Some people think med school or residency is harder transition, but I almost found undergrad like kind of easy, not like in a braggadocious way, but I just didn't have to be studying all the time. I could study a couple nights before and do really well. And then in med school, it just does not fly. It's just not fly. I tried to cram for maybe the first couple tests. And it just does not work. It's too much information. So that first year, getting in the groove of this fire hose of information coming at you and processing it and studying was the hardest part for me.
Did you use a note service?
A note service?
Yeah, don't they have note service where some people will take notes for you to study? I think those are big, aren't they, nowadays?
I did an undergrad. Yeah,
okay.
you could like pay someone for like study guides, and they would all be done for you.
But
no,
not
I use a lot of the
wow.
like new ones. Anki, the flashcard app.
Yeah.
It's really popular now. I use that.
And I think this was an interesting thing. We asked another resident before, but what was the transition like from undergrad to med school? You touched on that a little bit. And then what was it like transitioning from medical school to residency? Because I've heard it's a steeper curve even there when you transition.
Yeah. Yeah, it was tough. You're not only, man, you're getting called a physician for the very first time. You have those 2 letters after your name. And with that comes a ton of responsibility, this pressure in the setting of, I don't really know what I'm doing, but here's 10 patients on your first day.
Yeah.
Go, pre-round and go see them. It's like really intimidating those first few weeks. You're really worried you're going to mess up. I was triple checking my antibiotic dosing, things that wouldn't make a difference whatsoever.
Yeah.
But you just really feel hesitant to be a physician, even though these patients are calling you doctor.
Well, it's become real now. It's not just the textbook, right? And in studying. And I think I've heard my dad talk about it before when he went from residency to being a full-time doctor in his first, right, Dad, the first couple months of doing actual procedures with no attending with you.
It's horrible, but it's like self-inflicted worrying, like when you start. I remember my first rotation was in the ICU, my very first rotation in residency. And it's like, I don't know how to take care of these sick people. I just got out of freaking medical school. We're not in charge of anything at all, hardly. And now all of a sudden they want me to take care of a real patient. But I think, you got to rely on the nurses and your senior residents, but we inflict this on ourselves about how we think the world is all on our shoulders, and part of that you just have to get over. There's always backup for you. Talk to the nurses. The nurses can get you out of anything, honestly. The ones that have been there a while.
Oh, absolutely. When I was on the ICU, I basically used the nurses as my attending. What would you do next? Asking them. But
Yeah.
I think you hit the nail on the head. It's like in med school, you know all the information. You could get the multiple choice answer right. But
right.
once
That's
you have
a
a
real
patient
person
in front of you, it's way different.
Yeah. And you got to stay humble. You can't be arrogant. You're not going to get anywhere. No one's going to help you if you act like you're a know-it-all, so you got to really just soak it up. Yeah.
Yeah. One of the first things I told my new interns this year was be nice to everybody. And people say that, be nice to the nurses, don't make your life easier, but like really, meet someone new every day, learn their name. It makes work so much more enjoyable when you can, say hey to people, familiar faces, and they will help you out at the end of the day.
Well, and look at what a difference you can make because you're being nice about it. You went through it and now you're trying to help the people who are going through it right now to get through it easier. But, there are residents who just make your life miserable and they treat you like you're stupid and nobody. I hated that. Yeah. So it sounds like you're doing a great job with the people coming in.
Yeah, that's interesting. Do you think, I'm sure you've had attendings that are just mean people. And in residency, do you think that's because they were treated like that through their training and they think it's kind of, I was treated like that, so I need to do it to you?
I do. I mean, I think there's definitely an element of that just gets handed down, and they don't, why should somebody else have it easier when I had it so hard? But I mean, some attendings aren't happy. I mean, they're not happy people. They take it out in you. I don't know. There's probably a lot of reasons. And maybe they think it makes you stronger. I don't know.
I mean, it's kind of similar to the thought process once they implemented like the 80-hour rule. There's debates like on social media. There's some older doctors that are like, well, everyone today in meds or residency is kind of weak, blah, blah, blah. Like I had to do 120 plus hour weeks, even though that's not a great thing. Like it's kind of like badge of honor that you went through that if you're an older doctor.
How do you like staying up all night when you're on call?
It's, you know, it's not too bad. It's not too bad. Once you hit 3, 4 in the morning, things start to really, blend together, and you're really having to look at your list and make sure you took good notes. But
Yeah.
it's manageable. At my program, I feel so lucky to be here. We're not, they don't work us like dogs. We're not running the entire hospital. So it's the work-life balance is pretty good.
What's a typical day right now, second year resident in internal medicine? What's a typical day like or a typical week like for you?
A typical day on inpatient medicine, it's pretty much guaranteed 12-hour days, 6 days a week. Getting in around 6 a.m., sitting down, pre-charting the patients, reviewing all labs, get up and go see the patients, do all my physical exams, ask them how last night was, this morning. And then we have table rounds in my program. Thankfully, we're not, pre-rounding and then going back and seeing all the patients. We just sit down at a table, talk about everyone, and the attending will go see the patients. So we do that and then finish around 9, 10 a.m. And then it's put your orders in, do your notes, and then the consults start rolling in, or the admissions from the ER. So we take about 3 each is kind of our max through the day. So it's pretty light admission load. And then most days down around 5, 6, 7, 8 around there.
How long is your typical note? And do you have like well, I remember when I was a neurosurgery resident, like our notes are like that long, and then internal medicine has like 3 pages, but obviously it's much more thorough. But how are your notes nowadays? Do you have to are they AI generated, or do you have a template, or how do you do your notes?
So we, at my program, we use Meditech as the EMR. So there's not really good pre-templated notes or dot phrases or anything that's like AI driven. It's almost like prehistoric. It looks like Excel pretty much. So I have my dictaphone and I sit there and I say, patient is a 35-year-old female with past medical history of blank, blank, blank. And then she presents with, and then a paragraph about kind of her symptoms, and then paragraph about some history, and paragraph about labs and imaging. So it's a pretty good note every time.
Yeah, it's good that you do it all yourself, actually.
Yeah,
because that's the only way you get the real flavor of what you were thinking and what you really found.
Do you use the dictaphones? I've seen my dad always use that. Do you use that? Do you learn that when you just first become a resident, or do you guys use that in medical school?
The residents had access to it in medical school. We didn't as med students. We were just typing.
Mm-hmm.
And we have access to it now. And the first day I just picked one up and started talking into it. It just makes it easier and kind of fits better in my head. I could just say what I'm thinking, or, kind of put it in a cohesive way where just typing would feel more choppy.
Well, if you're like my dad, he can do it way fast. My dad types with 2 fingers. So, well, because I think a funny thing about,
well, I'm not type.
Well, no, you don't, he doesn't type, but I think the funniest, thing is like coming up, because now like the current generation comes up with like all this technology, and I guess it's changing. Like there probably will be more AI applications, but like my dad, his least favorite thing a lot of the times is he didn't like train with any of like the newer technology. He hates loading up some of the technology. So those will be some of his biggest pain points, but it just completely shifted. And I guess I think with AI, it probably will, that eventually there'll be more integration.
Oh yeah. Yeah. Our clinics have just an AI scribe now that they bring in on their phone, and it will populate the entire note pretty much.
Yeah, it's crazy. One of my partners, he'll go, so it listens to the office visit and then it generates a note based on what he was saying. See, I always go back to after every patient, I go into my office and I dictate a note because, like today I had 3 surgeries, and when I read my note, I want to know what I was thinking, what the film showed, why I made that decision, because I can't have AI deciding that for me. I mean, I need to know it. So that's why I do all my own dictations. I don't use AI at all.
Dad, do you think that if you're not the one to dictate it, So say if you're using AI notation, do you think that takes away some of like you're saying what exactly you were thinking because you know how you were thinking?
The thought process.
Yeah. So do you think it makes it harder to make a decision?
For what?
So like if like I think that's kind of a concern just across anything because a lot of times like writing and speaking is like helps people form like cement thoughts and just across any field. And with the rise of AI, more people are using that. They're not using you're not quote unquote using your brain as much, and then it's harder to like have a solidified understanding. And when you need the information, you don't have access to AI or it can't help with a specific decision like surgery.
Well, I think for me, just let me give you an example. Like, a case today, there was 2 nerves I wanted to unpinch, and I only knew that because the way I dictated my note, I made a special note that I needed to focus on not just the standard one, but I had to do an extra part of the procedure. But that I remind myself on my note when I dictate it. So when I read it at surgery, it reminds me, yes, I need to do that too. AI is not going to know that. AI is not going to pick that up if it's just listening to me in the office visit. So I don't know. And there's pros and cons to everything.
Your job's safe.
Yeah. I think there's a lot of power in as weird as it sounds, writing a good note. I can't stand it when a patient is transferred to you or they're admitted by another physician and then you open their note and it's just, problem number 1 and then a couple lines about starting fluids or whatever. There's no thought process behind it. And I think that's where the AI can be useful is kind of teasing out all those mundane, tasks or the billing criteria, they're looking for these specific things in your note, filling all that in. But I think there has to be some personal input.
So you made it through your first year. You got 2 to go. But so what would you say to people in medical school, their 3rd and 4th year? They're probably worried about their first day of residency too, especially the ones that are graduating. So what advice would you give them? Like, you must think back when you started, like what could make your life easier? What advice would you give them if you had any?
I would say just be ready to feel like you don't know what's going on. Be ready to feel intimidated and just kind of sit in that. I'm kind of into mindfulness, stoicism kind of things, and it's okay to feel like that. That's why me now as a 2nd-year resident is there looking at all of your orders, going to see patients with you, answering your questions, kind of just helping with every step. It's going to feel scary, but just, that's okay. That's your body telling you this is something new and kind of preparing you for it.
For fun, do the residents get together? You guys go out together as a group in your residency? Yeah.
All the time. Yeah. We're big into pickleball.
No, that's
really?
Yeah. We have one on the roof of the parking garage at the hospital.
Oh, I saw that video.
Oh, that's sweet. No, yeah, it's funny how pickleball in the last, 4 or 5 years just has exploded. And it's now like all the young people are playing it too. But it's definitely a lot of fun.
The orthopedic surgeons are loving it.
What's crazy too is I saw your freaking resident lounge. Jesus. You should have seen our lounge. We were lucky we had saltine crackers and a water in there. You've got like a full grocery store in there.
I feel lucky. I feel very, very lucky. I think that's one of the big perks about a smaller program is they can invest a lot more in smaller group of residents. Whereas if you have, 100 roaming around, it's way, way harder to cater to all.
Yeah. No, it makes it nice. Yeah. Especially when you want to sit down and just decompress for a second. You can relax and have something to eat. Yeah.
We have a Wii in there.
Oh,
that's big TV with Netflix.
That's great.
Everybody's going to know your program there.
But how do you kind of, other than going to the resident lounge and chilling out, how do you kind of try to de-stress? You working in medicine, any part of medicine, it's definitely a lot, very stressful. Are there things you try to do in your personal life inside and outside the hospital to kind of keep your mind right, just de-stress when you need to? Any habits?
It's just that kind of age-old saying, just leave work at work. As difficult as that may be, sometimes as a clinician, having to write notes or do things after hours, just leaving that stress or that pressure it takes time to learn how to do that. You get home, you're still thinking about things that you did, or, oh man, I'm wondering what hemoglobin's going to be in the morning. Just like leave that pressure, that anxiety that comes with being in the hospital there. And that's not easy. That kind of takes work and getting used to that. But kind of what I do. And then just the mindfulness thing, I feel like that helps me throughout the day, just not kind of lose myself in all the chaos of residency.
Tell us a bit about how you got started on social media. It looks like you just started, like I saw your first video, was it May 5th?
Yeah,
Or was it
recent,
May? Yeah, you just started pretty recently.
very
Yeah.
recent.
So
Yeah,
you're doing pretty well. What
yeah.
inspired you to start?
To be honest, I just was posting for fun at the very beginning. I posted a couple videos just to be creative and get something out there. And then they started to do okay. And I'll be perfectly honest, I was like, maybe I could make a little bit of money with this. I'm a resident. A little bit of spending money could go a long way. And I just started posting more, and I saw that people really gravitated towards seeing the humor in medicine, or the how cool it is to be a resident. I kind of try and portray that in my videos. I think it's so cool to be a physician. Not a lot of people get to do this, be in such a intimate part of people's lives every single day. So getting to kind of portray that and just have fun with it. Ended up having one video go super viral before the hospital told me to delete it. And then ever since that, the traffic has been good.
We had that experience. I mean, once people start really seeing your videos, then the hospital picks up on it, and that was a thing with us too. Because HIPAA's a big thing, and patient confidentiality, and so they're very worried about that. So
Yeah, I had to have some talks with the program director, kind of tease out what's okay, what's not okay. And they've been super supportive with it.
I think it's good. It's just the new age. I think medicine and healthcare, like hospitals and healthcare systems, are very like skeptical of new stuff at first, and they'll be behind the eight ball. But I mean, it's just how so many people consume information nowadays of, that they do, and they want to see. I think what's so cool about it is it gives you behind the scenes looks. And I think some people, like before we start with my dad's social media, I mean, people have this image in their mind of what a neurosurgeon is or these other things. And it's just not at all. Like me being his son for my entire life and seeing him versus what other people think would always be funny to me. This is not like nerdy, or he doesn't know every single thing under the sun. And he'll say that.
I do.
No, but I think, or he's not got a huge ego, which I think people will associate with neurosurgeons sometimes. So, but I think that it's cool seeing people. What's so cool about social media, all these different things, it gives people way more access to, like, hey, do I potentially want to go into this field? I can see the good and the bad, because people will post the not so fun parts too, but it's good. There is lots of great parts of medicine. I mean, you guys get to help people every single day. And like you said, how cool is it to be a physician? There's not, proportionate wise, there's not a ton of people in the world that really are. So it's a very cool thing.
Yeah, absolutely.
What's been your favorite part of social media so far?
I think just making people laugh. My videos page kind of leans to humor and the funny parts of being a resident, and just being, things resonating with people that work in healthcare. There's this kind of funny side to the darkness of disease and illness. I sort of found this almost niche playing towards nurses, and the nurse doctor relationship was not something that's really talked about. It's kind of this, they're the kind of front lines of medicine. They're spending all day with the patient, and we're writing notes, putting orders, new admits. So that relationship is so important, but with that comes, funny interactions, and kind of playing towards that, and seeing how much it resonates with people is so funny. And then I'm not really, I think there's plenty of people that are doing educational videos, and they're doing a fantastic job, way better than I would. So I'm not really wanting to do the educational, but more just show, like, I'm a pretty normal dude,
Yeah.
I'm not like a nerd, like you were saying, Kevin, I'm not the typical physician. So just showing people, like, hey, I'm a pretty normal guy doing this, and it's fun, and you can do it too.
I liked your video with your mom and dad too, about how when you got accepted to medical school, because I mean, that's a real thing. How proud were you when you got accepted? They were probably so proud of you. And that was like a real moment. I thought those were real moments.
Absolutely. Yeah. I kind of owe all this to them. They came from humble beginnings. My mom immigrated here from Iran,
Wow.
came to college and didn't know a lick of English. with 7 brothers and sisters traveling across the US as each one got a job to support the rest of them. And my dad, he grew up in a real small town in Georgia, kind of the first one in his family to have a good corporate job, worked his way up. Just, they both kind of came from nothing. But then they got to a point where they could make my life so easy. I didn't have to worry about having a job to pay for things, or they didn't make me do chores all the time to help around the house. I could focus on studying, doing what I needed to, or summer internships rather than a summer job being a lifeguard. They just made it so easy for me, and they've always been so proud. They never second guessed me. Sorry, in 7th grade, when I said I wanted to be a physician, they never questioned it.
First of all, it's incredible, just parents in general, the sacrifice they'll make to, help their kids have a better life. And I think to have support from your parents is, I've always had that from my parents as well. That's one of the biggest things. If you have support of whatever your dream is or whatever your goal is to try to accomplish, it makes a huge, huge difference. So funny enough, my first job was as a lifeguard in high school. But
great way to get your feet wet.
So that's the small amount of helping out with other people. But how do you think, as you've gotten further along in the medicine through undergrad, medical school, and now residency, how do you think that's kind of shaped your personal perspective? I know you said kind of stoicism. I'm pretty big into stoicism myself, but in terms of stoicism and just your personal perspective on life, has that shifted over time as you've learned more in terms of medicine and health and just patient interactions?
So I think it's just made me a better person overall, being a physician and interacting with patients. I just had a patient today that you get surprised by their stories. You can walk into a room and you see what they look like and immediately judge them or place, kind of the scarlet letter on them as someone you wouldn't associate with in the outside world. But when you sit down and talk with patients, I almost have fun with it, just squatting near the bed, kind of sitting down, joking with them. I've been telling my interns that too. It's okay to have some personality in medicine. You don't have to be the robots. And I think that translates perfectly to the real world. Is you don't know these people's story. You don't know what they're going through, and it's okay to be kind to random strangers, joke around with random people. It's so beautiful just to interact with everyone. Why wouldn't you?
I think one thing too, or just a piece of advice would be, I've learned through the years, is that when you're dealing with older people, I think a lot of doctors come in and they're very quick and the person doesn't answer right away and they don't think they know what they're saying to them and they walk out. You got to wait. When people are older, you have to just wait a moment because they're formulating their response, and they're in there and they're completely normal and they can have a normal conversation. But sometimes people don't give them enough time to get it out. You know what I'm saying? Have you had that experience? You have to give them enough time, because if you do, they have some great insight, great stories, but it takes them a while to formulate it, and some people think, well, they don't understand what I'm saying, or they don't understand and they don't think it's worth even talking to them, And I find, these people are in there. They're just like you and me. They have all the personality, all the stories. It just takes longer to get it out, So I would remind your junior residents of that, because I remind people I work with that all the time. It's got to give them a chance.
Yeah. Yeah. And it's weird now too and I'm sure you've kind of seen this over time, how quick medicine is getting, or the expectations. Kind of a lot harder to do that and sit and wait, but it's, utmost important.
I think that's a really great perspective, because in medicine, you kind of are forced to talk to strangers. And that's cool to hear you say that, of there is a lot that you wouldn't know if you hadn't gotten in depth or more in conversation with them just by looks. But in everyday life, we do that all the time as well. It's kind of hard to force yourself to go meet random people, but you never know if it's going to be someone that you'll really vibe with.
Yeah. And you kind of get good at it. It forces you to get good at being adaptable with different personalities, or just the ways people act and interact with, everyone in their life, it's so, so different. Every single patient room you walk into. So of course you could be really adaptable. And if you want to build that rapport, you kind of got to figure out, okay, what wavelength are you on? Let me try and kind of squeeze in with that wavelength as well.
And kind of flipping the question now, what's something you wish when you were seeing patients, or just maybe, or it could be friends in general, as you being a resident and physician, what do you wish people knew about physicians / healthcare workers / residents in general, that you think people maybe don't from your interactions, whether that's in the hospital or with friends and stuff?
First things first, residents aren't rich like doctors. People, my friends love to make the joke like, oh, can't span for dinner because he's a doctor. Wrong.
Yeah.
Barely making anything. That's, first and foremost. But I think kind of going back to earlier, just like we're normal people. I find that a lot of times in the hospital, you're trying to interact with a patient care tech or, the environmental services team. They kind of are afraid to interact with physicians as just humans or a buddy in that setting. But I think that's okay. I think it's, I'm a 28-year-old guy, just talk to me like that. You don't have to be so astute or say the right words to me just because I'm a physician.
That's a good point. You got to treat everybody the same. I mean, I talk to anybody in the hospital, doesn't matter who it is, but some people are afraid to approach you for sure because of what you do and your stature, and they won't approach you. But when you actually approach them and start talking to them, they're really cool. And those are the people I like talking to better than the doctors, well, honestly, because they're the cool people. I mean, it's like,
well, I think that's part of the whole social media thing. I know, Dad, for you, like you see people who come in, they've seen you on social media or like nurses or other stuff. I mean, I think that does give a little bit behind the scenes where maybe they thought this was just a really serious person. And then when they see you joke around a little bit, that might open it up of like, okay, this is, he's a 28-year-old too. He probably likes similar stuff as me.
I think one thing that would be interesting for maybe people out there would be, so, you're in your second year of internal medicine. So it's a 3-year program. So when you're done with internal medicine, you're an internist and you could practice just doing that. But then you're going to do a subspecialty. So maybe tell people about, if you just stop the 3 years, what would you do? What would an internist do versus somebody who goes on to do a fellowship like you're going to do? I mean, how do the lives differ?
It's one of the main reasons I chose internal medicine is all the opportunities that branch off of it. Cardiology, nephrology, endocrinology, rheumatology, gastroenterology, pulmonology, all these different organ systems that you could specialize in. So after 3 years of internal medicine, you can be a hospitalist, internal medicine physician working in the hospital, treating pretty much everything or being, touching everything with consultants like yourself, or working outpatient in a clinic as a primary care physician or starting your own practice. And then with fellowship, it's typically 2 or 3 years. I want to do gastroenterology, so it'll be an extra 3 years. After that, possibly another advanced fellowship, and advanced endoscopy is kind of the end goal. And after that, the lives can differ widely based on where you set up shop. Essentially, if you're setting up as a general GI doctor in a private practice, then you probably wouldn't have tons of call or have late hours. But if you're in a university setting, working in a hospital with these really advanced cases, then probably going to be working pretty good hours, covering call shifts, long shifts, etc.
So like when people go to their heart doctor and they see the cardiologist, they've done a 3-year internship, right? Like you're doing. And then they've gone on to do an extra fellowship to be a cardiologist. Not everybody knows that. Because I think some people probably just think a cardiologist goes to cardiology residency, and it's not like that, Everything branches off of certain things. And if you want to do interventional where you're doing heart casts and stuff, they probably have to do something even beyond the regular cardiology fellowship, I would imagine.
Yeah, it's another 2 or 3 year advanced fellowship.
So if you want to hear more or follow along with Dr. Tate, you can find him on social media. It's at Dr. Cam, and it's KAM. doctor spelled out, and then KAM. If you're interested, kind of follow along with some of his stuff. It's actually how we found him. He makes some
Yeah.
great content, some funny content. But yeah, we really appreciate having you on, Dr. Tate. I think people can learn a lot just of someone who's actually in the mix of residency and who has gone
Yep.
like in the current phase, more so than my dad, who's very old. Uh,
Wow. Harsh.
but yeah, we really appreciate your time and hope everyone enjoyed watching or listening to it. And until next time.
Yep. Thanks.
Thanks so much for having me, guys.